in and ready to roll right on time. My name is Charlotte. I'm from the Poultry Industry Council, and today we're going to do a quick webinar on preventing illness when possible. Today is September 18th, and a recording of this will be available at the end. We'll post it on our website, so make sure you check it out if you had questions or wanted to rewatch any of this information. Very briefly, I'll tell you what to expect today. So I will be presenting a little information about biosecurity. We'll have Dr. Brian Stevens from Canadian Wildlife Health Cooperative talking about sick monitoring of birds, sick bird monitoring and reporting. And Dr. Heather McClinchey will also be joining us to speak about avian influenza, about zoonotic diseases. We will have a presentation shared from CFIA, who will be on the topic of avian influenza update. And then we will, but unfortunately, there's no representative available to share, so we won't take any questions on that. I will have a live question and answer period at the end of this. So please feel free to enter all your questions, but we will only table them at the very end. The Small Flock Ontario is a project that's been funded through the Sustainable Canadian Agricultural Partnership, Poultry Industry Council, and the Ontario Ministry of Agriculture, as well as the federal Canadian government. In the interest of making sure that we are protecting illness and keeping it out when possible, we're going to talk a little about biosecurity within your flock. But before we talk about your flock, I just want to remind you there are a few simple ways that you can help increase the protection of your own personal family and friends. It starts out easily. Get that seasonal flu shot. In the industry, when we're dealing with poultry, it is basically mandatory for all of us to make sure we do it, and we do keep it up. And of course, if I had any health concerns, one of the first things I would advise my professional healthcare advisor is that I do have contact with poultry and when the last time I saw them, and possibly any signs or symptoms they are showing of illness as well. So without further ado, let's talk about your coop. There's a basic goal to biosecurity. We keep out what's out to keep what's inside safe from disease. Now, there's a lot of versions of disease, and both of my other speakers will be touching on more of this for you today, but that gives you an idea of what we're talking about when I say disease-causing agents. When we're talking about managing risk, you always want to do it in the best way possible. In the industry, we refer to controlled access zones as anywhere that a public person could come onto my property. As you can see here in the picture, there's a little chain and a stop sign to advise them they cannot go further. If we're talking about a restricted zone, that's actually my coop, and I'm keeping that locked so that only personnel and equipment that has access and is properly cleaned and biosecure is able to make contact. So again, just points of entry for my control zone could, in your case, be a driveway, laneway, gate, or maybe even a sidewalk. The restricted areas should certainly be where my birds are: the yard, the coop, the runs, their food, water, equipment, and the people. I'm going to break this down into 5 high-level points, and they're your opportunities to manage risk. We can restrict visitors, observe proper hygiene, prevent contact with wild birds, don't bring diseases home, and recognize and report the illness. So first we'll go into restricting visitors. And I mean anyone who is dealing with equipment, people, or animals. And equipment, in our case, might even be someone who is cutting the grass. And I need to know that that equipment is clean before it goes into where my birds are roaming, due to the fact that they could be spreading disease. I want to restrict those visitors so much that I only allow contact with my birds for people who are required to give them care, if I'm going away on vacation or if I'm seeing a veterinarian. I just want to toss out there too that rodents are a visitor. However unwelcome, they will still try to visit. I would just want to remind you that mice can enter through the size of a dime hole, and a rat can get in the size of a nickel. So next time you're walking through the coop, just have a quick look, because we do not want to encourage them coming or potentially killing young birds or chicks. Proper hygiene. Wash your hands before you go in, as well as when you come back out of any contact with poultry. Before we go in is keeping the unwanted illness out of my coop, and when I come back out, it's keeping it from my home. In a perfect world, I would give everyone coveralls, gloves, and boots dedicated for nowhere but their coop. However, in this world where it could just be in my backyard, I'd encourage you to at least have a change of clothes that you only wear when cleaning or coming in direct contact with their animal droppings or the birds themselves. At the bare minimum, I would ask you to invest into some coop Crocs that are the footwear you dedicate to only wearing in there. If none of this is possible, some booty covers can even do. We want to prevent contact with wild birds because they can be carrying disease or microscopic organisms. This is trickier with my backyard flock. However, keeping my run clean to keep out any attraction from birds coming in. And in this picture, you can even see there's a chain link fence in the run to keep them safe. When it comes to geese, it's a little bit trickier. But you could have an overhead run, or you could have a gated laneway that leads them to the natural source of water that they're craving. Never bring disease home. This could be the birds themselves, or in this case, it could even be the crate that you're bringing home. When birds get together, we call it commingling, and commingling is a huge risk. Not only did I bring my most beautiful bird to the fair and won a blue ribbon, but I also came home with disease because commingling affects where birds can spread disease quite easily from one to another. I would just ask that before you enter into these activities, you make sure that you're ready for what you're coming home with and be aware that you are commingling. When you come home, isolate and quarantine. Isolating either away from the rest of the flock or away from the other birds, as well as quarantining any bird that's been in a separate commingling event. So if I took a duck and a chicken, they have to isolate and quarantine separate from one another. And they should not have access to my healthy birds. Once I've gotten through the quarantine period, which can be anywhere from 14 to 21 days for certain poultry viruses, we would then reintroduce them as long as they're looking healthy. How do I know they're looking healthy and what do I do? I'm looking to recognize the illness and report the disease. So a very important step in this is remembering that your birds are a prey animal. They will do anything to hide the signs of illness. As soon as I start to see one looking unusual, not behaving in its normal manner, that's the time that I need to report. No one's going to know your birds better than you. So just jot down when they started behaving differently, what behavior, feed consumption, and keep a timeline because that can better help a veterinarian to properly diagnose not only that bird, however, the rest of your flock and the spread of that disease. These are general illness topics that could be literally any disease, but your veterinarian would know which ones are stacking up like what. So anything abnormal with the eyes, breathing like wheezing, absence or decrease in eggs. Abnormal poop can be tricky because it can look a lot of different ways, but Alltech has a great poop chart or a feces chart that can tell you what's normal and what things might be representing other things. But of course, pale skin or combs, definitely time to do the next step, which is report. Now, this can be very simple. Just call your veterinarian. You'll have information on what the illness was, how it tracked, and how quickly it progressed. And that's very crucial information for your veterinarian. So from Small Flock Ontario, we thank you for paying attention. Biosecurity is a serious step, not only to keeping your family and household safe, but also to keeping your birds safe from what's out there. Now, without further ado, it is time for me to end my portion, and we'll move on to our first expert speaker. Dr. Brian Stephens from the Canadian Wildlife Health Cooperative is going to talk to us a bit now about how we can take these steps to the next level. Thank you again for joining us today, Brian.
Thanks, Charlotte. So today I'm going to do a little bit of a different talk from what I typically go through. And today I want to cover some diseases in wildlife that could potentially affect domestic poultry. So I've got a list of 5 diseases here, and I'm just going to go over these quickly just so you're aware of them. And just so you know that there's more than just avian influenza. I know I talk about that for the most part, and I will still talk about that today. but there are other diseases and other species that we do want to recognize as potential risks to our poultry. So avian influenza, I won't go into great detail for this. I talk about this pretty much at every webinar I speak at here. But just to give you an update on how things have been going, what we've been seeing in wildlife is that we've been getting fewer deaths associated with this virus. We do know that it is still circulating, but you can see kind of how the numbers have changed over time to the fall of 2023, where we had quite a large drop compared to 2022. And a lot of that was still birds migrating through the area. And that's really the biggest risk time frame for this, is when we have birds in spring migration moving north or birds in fall migration moving south. That's the biggest risk time frame for us when it comes to wildlife carrying this virus and potentially bring it to our flocks. Just so you know, you should stay vigilant at all times. This was a good reminder of that in the winter of this year, where we did have some outbreaks in January, February, which were not associated with migration. So we do know that other time frames there are risks as well. It's just the migratory period is the biggest risk. So far, what we've seen recently is that cases in wild birds have decreased over time. We know that it's still circulating in these birds. Healthy birds are testing positive for the virus. So we know that the virus is still out there in our ducks and geese. It's just our wildlife have probably built up some immunity to this virus, so they're not dying as much as they were before. And any illness that they're getting is obviously not as severe as it used to be. If you want to go looking for information, I've put this up previously, but CFA has a wild bird dashboard. This covers also domestic poultry as well. You can find this on our CWHC website. If you click on the avian influenza, you can find a link to this dashboard very easily. And you can kind of go through and click on different things to find out what are the most recent cases, where they are, and kind of bring it up on a map. So going beyond avian influenza, I'm going to talk about a few other diseases that are potentially diseases that could jump into poultry. So the first one I'll talk about is fowl cholera. I refer to it as avian cholera because I'm dealing with wild birds and not poultry. And it's a bacteria called Pastorella maltosida. And I have a picture of a cat there. And that was mainly just to remind myself to let you know that this bacteria is pretty much everywhere. One of the most common places that it's found is actually in the mouth of cats. So if animals ever are bitten by a cat, there is the concern of this bacteria being transmitted through that bite wound. And this is actually why cat bites are very serious for humans as well, is that this bacteria can be quite severe for people as well. And that's why any cat bite is recommended to seek a professional, healthcare professional. But unrelated to cats, for our wild birds, we can get this bacteria affecting wild birds in different ways. Typically, it is going to be an infection that goes throughout the entire body, or it involves the respiratory system, so the lungs, in the case of many of our birds. We typically see it in our double-crested cormorants, snow geese that move through the area, and then water birds are the other ones that we will get this. And the other thing to know about this bacteria is it is out there in the environment in many different places. But one of the ways that you can prevent it getting into your flock is to minimize that contact between wild birds and your flock, as Charlotte has just pointed out. Another disease that I'll mention is one called Newcastle disease. This is a virus. It's called avian paramyxovirus. This is one that typically when we see this affecting wildlife, they're going to get neurological disease. So they're going to have abnormal behavior, seizures. Sometimes they will have odd posture as they strain their neck. The one thing to know about this is there's many different strains of this virus out there. Similar to avian influenza, there's some that don't cause disease or don't cause severe disease, and there's other strains that cause severe disease, similar to what I've talked about with the highly pathogenic avian influenza. This one tends to affect our double-crested cormorants, and pigeons are the other ones that will carry this quite readily. So in our cormorants, we typically will see occasional cases around the Great Lakes, and occasionally we will get larger outbreaks and mass mortality events. The last one we had was in August of 2018. And that one you may have heard about in the media because there were many cormorants that were being found in public parks in Toronto exhibiting abnormal behavior or dying in front of people. So that one was publicized quite a bit. Previous to that, our last large outbreak in this species was in 2009, and it tends to be around that 10-year cycle that we see these larger outbreaks in our cormorants. For pigeons, they have actually their own pigeon paramyxovirus that they carry. It's very similar to the one that typically causes Newcastle disease in poultry, but it's not actually called Newcastle disease. But it can be transmitted to poultry. So that's another thing to be aware of, is that pigeons are one of those species that tend to be around farms and tend to be around areas where poultry may be. And this is one reason that you want to try and minimize any contact between poultry and pigeons, as they could potentially carry viruses like this pigeon paramyxovirus that could cause disease in your poultry. One other that I'll mention here is more to get across the importance of if you are going to have backyard poultry, then deciding what you do about bird feeders on your property. The main recommendation would be to not have bird feeders if you are going to raise poultry, and that's to minimize any contact between songbirds and your poultry as well. So one of the diseases that we will see occasionally associated with bird feeders is mycoplasmosis, and this is a bacteria. Another one would be salmonella. We do see that quite commonly in songbirds as well. This one tends to be, this mycoplasma tends to be in house finches, and typically how it's transmitted is from bird to bird because it doesn't survive in the environment very long. So that's why bird feeders can be an important area for transmission, because you have a lot of birds coming together to feed at the same place. They're going to transmit bacteria and other things to each other very easily in that respect. When we see this in house finches, what you'll see are really swollen eyelids. Sometimes they can be crusted over and completely shut. Sometimes they'll have nasal infections and respiratory disease. And just this generalized poor health where you see these finches kind of puffed up and not really looking like they're feeling great. This bacteria can be transmitted to poultry, and poultry can get very similar respiratory signs to these finches. So this is something that, just as a reminder, even though we're not talking about avian influenza or some of these others, songbirds could potentially put your poultry at risk as well. And then I don't know how many people are going to be raising turkeys, but it is good to know that there are other things that wild turkeys could be carrying that could put your flock at risk as well. One of these diseases is called lymphoproliferative disease virus. And what this does is it actually causes these tumors over the skin. So you can see this picture of this turkey with these masses over the head and neck. So this is something that we know is out there in wild turkeys. One study that was done before I got here was kind of an overall look at turkeys, and I'll talk more about what they tested these turkeys for in a second. But one thing they tested them for was this virus, and they found that approximately 2/3 of the wild turkeys had been exposed to this virus. Most of them weren't showing evidence of disease, but it is something that this virus could be passed on to our domestic turkeys and potentially could cause disease in our domestic flock. In addition to that one virus, they also tested these turkeys for other things. So good news in that when they tested the turkeys, and this was probably about 7-8 years ago, the turkeys weren't carrying avian influenza, the ones they were testing. They didn't see evidence of that Pasteurella maltosum, so that's the bacteria I talked about with fowl cholera. But one thing they did find was that a small percentage of these wild turkeys was carrying other mycoplasmas. So I just talked about a mycoplasma with finches. These are different mycoplasmas, so a different type of that same bacteria that could lead to disease in our domestic poultry. So that is something to be aware of, as well as if you're in a rural area where turkeys are going to be around your property, they could also potentially be a risk. So another reason to have some sort of biosecurity to not allow these other birds coming in contact with yours. Overall, the good news for the turkey surveillance project was that they appeared to be in good health, the wild turkeys overall. And even though there was a small risk, it seemed to be quite low. And that was good news as well, that yes, these turkeys could put your flock at risk, but the chances of them transmitting something are probably going to be very low. So you still want to recognize that you should have good biosecurity, but the risk from the turkeys is probably not as severe as it could be, which is good news. And the last thing I always mention with these talks is the main plug. If you ever find dead wildlife on your property or out when you're in the environment, definitely please contact us at the CWHC. We do have a toll-free number there. We have an email you can contact us at. There's an online reporting system as well. So there's multiple ways to reach out. And you can always contact us with questions about whether or not we want to get this animal in for testing or what to do from there. But I will be sticking around, so if you have questions at the end, you can definitely pop them in the Q&A and I'll answer them at the end.
I have a quick question before we even get to the end. What office
Yes.
hours is that phone number manned?
So it is the typical business hours. So kind of a 8:30 to 4:30. Somebody will be around Monday to Friday. Nobody is there on weekends or holidays. So if you do call Friday at 7 o'clock at night, unfortunately, no one will get back to you until Monday. But if you call during regular business hours, somebody should be able to get back to you relatively quickly.
So I had a personal experience with a bird late at night on a Friday evening, and there would be no one to answer the call. What should I do next if it's a suspicious dead bird?
So what you can do is there's a few things. One would be if you have a municipality or humane society that would be available on weekends, contacting them to have an animal service person to come out, retrieve that animal. They could then bring it back and contact us. And that would be a good way because they would have freezer space and things like that. If you are not in an area like that, then the things we typically recommend is take your own precautions first. So if you have to handle a bird, what you want to do is make sure you're wearing disposable gloves, get 2 bags, double bag this animal, and basically treat it as if it was a dog poop in your backyard. Invert the bag over it with your gloved hands so you're never in contact with the bird. Put them into the bags, take off the gloves, stick them in the bag, tie it up to seal it, immediately wash your hands well afterwards. And then you can keep that in an area, a cool area, ideally somewhere that it's not going to be scavenged by another wild animal. But don't bring it inside, don't bring it into your own freezer. Ideally somewhere outside in a safe area that you can keep it cool until you can contact us on Monday. Typically, I try not to have people do that too often, just because it's good to contact somebody like CWHC or another expert to kind of assess the situation and make sure that we're keeping your own health as our first priority.
That's excellent to know. Thank you very much, Brian, because it's always Friday on an evening late at night
Yes.
when suddenly something happens, and good to know. Don't touch it. Don't bring it into my house.
Yes.
And I'll keep in mind, treat it like a dog poop, double bag it.
Yeah. And wash your hands well if you are going to be touching it, even through the bags.
Yeah, disposable gloves, but keep biosecurity, good
Yeah.
hygiene, wash my hands.
Yeah.
Awesome. Thank you, Brian. In the line of preventing illness when possible, it's best to be able to know what the risks and the signs are. So we're going to move from the wild bird world into the personal health. Dr. Heather McClinchey from the Ministry of Health is here to join us to help us know more about zoonotic disease risks and what we should be watching out for. Thank you again for joining us today, Heather.
Oh, thank you very much, Charlotte. So, as Charlotte said, I'm Heather McClinchey. I am a public health veterinarian in the Office of the Chief Medical Officer of Health at the Ministry of Health. I am honored in that I am the only veterinarian in the entire Ministry of Health, and my job as a veterinary consultant is to help my colleagues within the ministry. I work with colleagues at other ministries and external partners, like with Dr. Stevens at the Canadian Wildlife Health Cooperative. And I also help the 34 public health units in Ontario if they have any disease issues that we need to work through. So I thought today we would go through zoonotic disease risks, and talk about what they are first, just to make sure we understand what they are. To understand the role of public health units and what are the reportable diseases in Ontario. And then I'm going to go through some disease examples, kind of what's in the news right now, some of which can be transmitted from poultry and some of which can't. But I'll talk about why we're concerned and what you can do as poultry owners to protect yourself and your family and to reduce risk. So just for awareness, zoonotic diseases. These are infectious diseases. So these can be bacteria, viruses, fungal agents, parasites, and even some proteins like prions, which cause a mad cow disease, that are transmissible from animals to people. This transmission can happen in a number of different ways, whether it's through direct contact or bites. It can be foodborne, can be from environmental surfaces, can be airborne, or we also have some vector-borne diseases, and some of which we're going to talk about at the end, which can be transmitted by mosquitoes or by ticks. In terms of reportable zoonoses, we really are concerned about those which can cause severe disease in animals or people. We are concerned about those which may impact trade or food safety. We also are concerned with those that may be used as bioterrorism agents as well. And we want to make sure that we are alerted quickly to those diseases, because we may not know if one situation's happening in one area of the province, another situation's happening in another. We want to have a centralized location to hear about all of these. The public health units in Ontario, as I mentioned, we have 34 of them. This is a very wordy slide, and I apologize for this, but this is just a very, very small portion of the role that the public health units have for people in Ontario. This in particular are the roles that they have in terms of zoonotic diseases, because they also have health promotion work. They do school vaccination programs. There's a variety of different wellness and health programs that they run. But this is what they are responsible for in terms of zoonotic disease. So here in Ontario, we have quite a unique system of reporting in that our public health is alerted to certain animal diseases directly. So instead of going through our agriculture ministries or our wildlife health ministries, they get direct reports. These are for diseases which we'll mention in the next slide. And they also have a role in investigating human disease. And it's linked to animal sources as well. So we are really working in a One Health collaborative environment where we're engaging our veterinarians, engaging our public health, our agriculture ministries, the Canadian Wildlife Health Cooperative, in terms of trying to investigate and manage some of these diseases. This is a small portion of the reportable diseases in people in Ontario. As I mentioned, we also have uniquely here in Ontario diseases in animals which are reported directly to public health. Those are rabies, avian chlamydiosis, which is also known as psittacosis, which mostly affects household birds like parrots. We have Echinococcus multilocularis, which is a parasitic disease, and our influenzas that come from birds, from pigs, and any novel, weird, and wonderful species in animals are also reportable to us. We want to make sure that we're tracking that and preventing that from getting transmitted to people. In terms of our people diseases, there's lots, and some of them have an animal source, some of them do not. And so sometimes we have an animal investigation concurrently going on, depending on the situation that we're in. In terms of backyard poultry, the big elephant in the room is salmonellosis. And the Public Health Ontario has done a really nice job of putting together this guidance document to speak about some of the biosecurity and human care that can try and reduce the transmission of salmonella from poultry to people. The reason I'm not going to spend a whole lot of time talking about it is salmonella in birds is so common that we don't get it reported up to public health. We just cannot have the capacity to follow up with every case. There really isn't an expectation that every chicken in the province is ever going to be free of salmonella or Campylobacter or some of these other enteric bacteria. So we just assume that the risk is there, and we try and prevent disease transmission at the animal-human interface. So please go out, check out this Public Health Ontario resource. It's fantastic. So what I am going to talk about today are I'm going to talk a little bit about avian influenza and a new twist to the story that's come up recently. So just for everybody's awareness, this situation started, this latest panzootic started in North America in December 2021 in Eastern Canada, and in Ontario, we started dealing with it in springtime of 2022, and it really has consumed a lot of my time and my work for since then. Canada has had a total of 420 infected premises as of 2 days ago. These are commercial and backyard flocks, 48 of which have been in Ontario. And we've lost in excess of 11 million poultry in Canada, which is an awful lot of birds. That in itself is a shocking number, but when you look at the situation in the US, they have lost now over 100 million birds from 1,173 flocks, 665 which are backyard. So this tells you about the 500 or so commercial flocks and the size differential between Canada and the US. They have enormous flocks, sometimes in the millions of birds on one property, and it's been incredibly impactful. In March of 2024, we got a new strain of avian influenza called B3.13. It has been infecting dairy cattle, and it also is colloquially known as the dairy cattle strain. So sometimes you'll hear that in the news. And this happened from a single wild bird to cattle transmission event, estimated somewhere November or December of 2023. And since then, it's spread to herds in 14 states that we know of. It's been transmitted to other mammals, especially cats and some other rodents. And it's also been implicated in some poultry infections as well, and causing the same death and destruction that it does, that the non-dairy cattle strain has done in poultry. So we have current evidence to suggest cattle to cattle transmission, cattle to poultry, cattle to mammal, and we've also had cattle to human, and we've also had poultry infected with this dairy strain to human as well. There has been it was talked about very hush hush for a while, and then the news got sort of more, the chatter got more common, and we do know that there has been underreporting of cattle cases and human cases of this H5N1 in the States for a number of different reasons. But suffice it to say, because this disease doesn't kill dairy cattle, it just makes them sick and they recover. The same with people. There hasn't been the same drive to report as there has been with poultry, because it is a devastating, fatal disease in most commercial poultry operations. In Canada, we've been, knock on wood, very fortunate not to have any of these cases here yet in Canada. But there is a lot of concern, especially as we're heading into the fall and agricultural fall fair season, There are a lot of cattle that historically move across the border, both down to the States for shows and up to Canada, like the Royal Winter Fair in Toronto. And the CFIA is leading that surveillance response. They are putting in export and import restrictions to try and dissuade people from moving their cattle across the border and increasing the risk of this disease coming into Canada. So on the public health side, what do we want people to know? The risk to the general public is low to very low, which is a huge relief. But there is occupational risk that is low to moderate for people that are working with animals, susceptible animal species, and especially poultry. We do have resources on our Ministry of Health website. These are personal protective equipment recommendations. The Public Health Agency of Canada also has resources, and you can go and seek these out. As Brian mentioned, we discourage you from handling sick and dead wildlife. You either need to call animal control, a wildlife rehabilitator, or if you're dealing with dead wildlife, please call the Canadian Wildlife Health Cooperative. We want to have good hygiene after touching livestock and poultry, and we want to make sure that we don't have manure on our footwear that we're taking from, say, a fall fair back to our home properties. In terms of food, poultry and red meats are safe to consume if properly cooked, even if infected with avian influenza. We would highly discourage feeding raw meat and raw poultry to pets, even if it's considered a human grade meat, because that does not ensure that it is free of bacteria. It just because we assume that it does have bacteria and that's going to be killed in the cooking process. Make sure your food preparation surfaces where you've handled touched raw meat are cleaned thoroughly after use. From what we know of the research so far is that pasteurized milk products are safe, even if infected with avian influenza. But the CDC for now is recommending to hold off on consumption of raw milk cheeses. There still is research ongoing. From what we can see, it probably is safe, but we're still holding on finalized testing for that. And as Charlotte mentioned at the beginning of this presentation, I can't stress enough the importance of telling your healthcare practitioner if you are sick that you've had access to birds or animals. This can help your healthcare provider with a differential list for diseases and can help them focus on rule outs and testing. And we do strongly encourage you to receive your seasonal flu shot for anybody who is dealing with birds or livestock this year because of these influenza risks. It may not protect you against H5N1, but it will prevent you from being dually infected with multiple strains. That's where the super nasty bugs get mutated. Seasonal flu shots will be available in Ontario at no charge at the end of October this year, so a little bit later than normal. I do have some public health resources. You can search them up by the titles here if you don't have the presentation at hand. The next I'm going to talk about, just because it's been in the news recently, is rabies. We have had a human case in Brant that occurred from direct exposure to a bat. Almost every mammal in Ontario is at risk for developing rabies. Thankfully, birds are not. However, having said that, we want to give you some good advice on how to keep wildlife separate from your birds, because birds are an attractant for many mammals. In Canada, we have 4 circulating strains of rabies: raccoons, skunks, foxes, and bats. So these animals are the reservoir species for these these particular strains. There are maps available to talk about risk of terrestrial rabies. It does vary by location in Canada, so certain areas are at lower risk than others. But it is important to understand that any bat from any location in the country poses a risk for rabies. So just because a bat hasn't been diagnosed in the area does not make it safe or safer or less, or have that area be safer for you. It is probably just a lack of surveillance. So as I mentioned, we want to try and prevent wild animals, including bats, from entering barns and homes, and that's incredibly important in reducing your risk for rabies. We want to contain waste to prevent scavenging by wild animals and domestic animals, I guess, for that point. Vaccinate any eligible pets and livestock. Sick and dead wild animals should be reported to local wildlife custodians or the Canadian Wildlife Health Cooperative. And if you've been bitten or scratched by a mammal capable of carrying rabies, or you've had direct contact with a bat, that is bat to human contact, you want to be washing any bite or scratch well with copious amounts of warm water and soap. You want to call a healthcare provider immediately or go to the nearest hospital. The healthcare provider, in consultation with local public health, will assess the risk of rabies and determine if vaccination is recommended in your situation. If you can't get to the hospital or a local healthcare provider, at minimum, please contact your local public health unit where they can help you do a risk assessment. Key takeaways I would like you to understand is rabies virus is transmitted by neural tissue and by saliva. It is not transmitted by blood, urine, or feces. Human rabies vaccines no longer go into the stomach, they go into your arm. They are a lot they're a lot easier and much more benign than they used to be. So please don't let that be a deterrent for you in terms of seeking care. When it comes to domestic animals, public health units really want to observe these animals for signs of disease. This can be for 10 to 14-day period. They really don't want to test them. So a dog that has bitten a person, a horse that's bitten a person, they're not going to get euthanized for testing. In 99.9% of cases, the public health unit will observe these animals, release them at the end of the time, and everybody goes on with their life. It's a different situation for some wild animals. Wild animals, particularly our foxes, our skunks, and our raccoons, and our bats, if available, will generally be tested to rule out disease, if available. If not, you may, depending on the situation, be recommended to receive vaccines. Early healthcare intervention when we're dealing with rabies risk is really important, because it's in those cases where it's almost 100% effective at preventing disease. Once you have rabies, your fate is determined, unfortunately, and it is fatal in almost every case. So if you've had direct contact with bats, or you've had a bite or saliva contaminated scratch from an animal capable of carrying rabies, please seek care immediately. Rabies vaccines for domestic animals, not all, but any animal that has a licensed rabies product available is required to be vaccinated. It is cheap, it is effective, and it is required by law in Ontario. I'm just going to touch briefly on vector-borne diseases. You'll hear lots of talk in the news right now about West Nile virus and Eastern equine encephalitis. They affect species of birds, they affect horses, and they affect people. Birds and horses are not a direct risk to people because these are spread by mosquitoes. But what the birds and horse cases can tell us is where the virus is circulating and when it is circulating. So it's incredibly important that we have these surveillance cases and information available for the public to talk about location and risk. In horses and birds, some species of birds rather, We do have vaccines available to prevent disease. Unfortunately for people, we don't. So we really are looking at trying to do mosquito control and for recommending, and we do recommend eliminating mosquito breeding habitats from your property. I've put on the right here some symptoms of West Nile virus. Vast majority of cases, they're going to go undiagnosed because they're causing very, very mild disease in people, and sometimes no disease in people. But we can get severe disease and unfortunately even death. And you will have seen or may have seen some reports of that situation happening in Ontario this year. So if you have been bitten by a mosquito, you're feeling unwell, please let your doctor know and they can go ahead and do some testing for you. And happy to take any questions at the end, if you have any.
That's great. Thank you so much, Heather. Knowledge is power, and we're just trying to empower everyone today to take best care possible, not only of their family, but their flocks, preventing illness. Yeah, we can't say it enough. Just get your seasonal flu shot. If you have poultry, it's fairly important, and apparently with almost any livestock. But also, there's other illnesses out there, and so recognize those signs. If you have anything that's attracting even raccoons, the cases of that first case of human rabies this year, really, it sent me for a shock. So I'm glad that we're getting the information out there, making people aware and how they can protect themselves.
Absolutely. Thank you.
Thank you. I'll just mention our Q&A currently is empty. So if there are no questions, then we will just be wrapping this up at the end. Our last presentation is from Canadian Food Inspection Agency. Again, unfortunately, they were unable to join us today. They have permitted the sharing of their slide deck. Now, I will put the preface out there. I cannot share their slide deck. There was a question if we can share any of them. And you're more than welcome to email me directly through the info@smallflock.ca to receive information if you would like, and I will follow up with speakers. However, this one will not be available to share, and I cannot answer any questions on it as it is not my own material. But all that being said, if you do have questions, again, reach out to me. I'll do my very best to help. So without further ado, we will get our Canadian Food Inspection Agency influenza update for September of 2024, moving right along here. We're going to start off with definitions so that we're all on the same page before we move any further here. Non-commercial or small holding poultry is birds raised in flocks that are fewer than 1,000 birds and fewer than 300 ensiforms for producing or selling their products for local or limited sales or for breeding for these purposes, and no direct or indirect contact with commercial premise. If you're a non-poultry, we would define you as basically everything is used on farm or with the immediate family, and nothing is sold, given away, and has no contact with other poultry facilities. Commercial poultry is chicken and turkey raised under Canadian supply management quota. So systems for producing or selling products or for breeding of these purposes. Or if you are raised outside of the quota system on a premise that has over 1,000 birds or more on that site, if you are producing or selling products or breeding for these purposes, if you are over 300 ensiforms or producing or selling products or breeding for these purposes. So they did add the note that the word I have difficulty pronouncing are domestic waterfowl, such as ducks and geese. A little more definition before we get into the stats. An infected premise, which we'll call an IP moving forward, is a property where avian influenza infection has been confirmed and where a legal order has been issued to declare the premise to be infected using a Canadian Food Inspection Agency form 4204. So that makes you an IP. A primary control zone, a PCZ, is a geographic area surrounding an IP where the legal restrictions are placed on the movement of animals and things that have potential to spread disease. Permissions are required for movement to occur. A PCZ is made up of two zones, an infected zone immediately surrounding that infected premise or IP, and a restricted zone that surrounds the infected zone. Now, our current status of these details in Canada, as of November 15th, 2023, we did have a non-commercial poultry location in Saskatchewan that was identified as IP 41 for infected premise, and it turned into PCZ 219 as of today, or actually Friday when I received the PowerPoint, it was still active. There is currently one primary control zone in Canada. So that's it in Saskatchewan. Our stats of how we've made it so far are seen below. And these are the numbers of active, revoked, total PCZs, non-commercial, commercial, all and everything in between. So we're going to just talk briefly here about what happens when a positive result comes into CFIA. So upon any suspicion of highly pathogenic avian influenza, legal orders are issued by a CFIA inspector to the owner of the flock or of the property to restrict the movement of animals and things. And this declaration of infected premise and a requirement to quarantine. Samples are collected and sent to a laboratory to determine if HiPath AI is present on the premise. If it is confirmed in the poultry on the premise, a legal order will be issued requiring the poultry to be disposed and the birds will be destroyed. A PCZ is created for that commercial and non-commercial flocks to control movement of poultry and things from farms surrounding that infected premise, but not for a non-poultry infected premise. So continuing on, once the birds have been euthanized, disposal of them occurs. There's 3 disposal options that you will be presented with if this was a case, or if an officer is going through this with you. You might choose composting, burial, or incineration. Composting is typical for commercial barns. It's building piles in the barn containing a mixture of carcasses, litter, and manure based on a very clearly prescribed building plan. The piles are capped with wood shavings or mulch to enclose the material so that the composting process can start. And we'll just mention that when I say capped, capping the pile is a milestone that starts on day 14 of a surveillance period where sampling is done for all farms in that primary control zone. If there is no spread of infection detected during the surveillance, and the infected zone and restricted zone will change their security zone, so they'll change status, which has a less restrictive movement requirements for moving in and through. Once you've got it capped, the temperature probing of the piles is done to confirm that the prescribed temperatures are reached to ensure that the virus is inactivated. The bioheat treatment, or BHT, is complete once the pile is 37 degrees Celsius or higher for 6 consecutive days. Piles will be or may be moved outside after the completion of this bioheat treatment. Once the BHT is completed and the compost materials are moved outside, the barn cleaning and disinfecting then begins. Primary decontamination is one of the first levels of cleaning and disinfection and is a milestone to start post-outbreak surveillance to remove that PCZ. Primary contamination is defined as initial virus elimination activities on the infected premise following the destruction and disposal activities to mitigate the pathogen transmission from the site. Activities will include, but are not limited to, the following: a complete dry cleaning of bird housing and areas or enclosures. So that could be barns, outdoor pens, coops, anywhere they've been, including cages, nest boxes, floors, slatted floors, walls, manure pits, in the barns, feeders, waters, ventilation, etc. And a complete dry cleaning of egg collection, grading, and storage rooms or anterooms and other transmission areas. As well, removing accumulations of litter and manure in outdoor pens or ranges in areas where birds congregate around feeders, waters, coops, etc., and the accumulation of manure and feathers from premise laneways and roadways. One more for you: cleaning and disinfecting items that are or were heavily contaminated and could pose a risk for transmission of the pathogen off the site, such as a skid steer or a tractor, any large portable equipment that was used. Now, how do I know where these zones are? Well, there's an interactive map tool for that. It is very useful for determining if a certain address is within a zone or just an overall view of where the control zones are and were. To do so, you just search an address in the top left-hand corner of their map. So when you first go on, there's your spot for putting in the address that you're concerned about if you're traveling to. If it happens to, so there's a very clear indication of what each of the colors means, you can select or deselect to vary what you're looking for on the map. If it looked like this and it was a red, that is a commercial security zone. If it's looking like this, it's a purple and a red, it's a commercial restricted zone. As we talked, circle within a circle, it's also a commercial infected zone. So the purple is one, the red is the other. Restricted and security. Now, a non-commercial restricted zone and non-commercial infected zones are demonstrated in the bottom center map. They have oodles of resources. There are links, there are websites, there are tricks for biosecurity, there are information specific to small flock and pet owners. If you had to go through a control zone while it is active and on the map, there is a process, and I encourage you to check out the movement of flocks. Again, if you have a sick bird and you need to report it, I would recommend a veterinarian first. They would take these actions. However, you are welcome to contact directly to the Canadian Food Inspection Agency. With that, they would like you just to remember, as we started this webinar, biosecurity is your best friend. You can scan this QR code at any time to check out more information and learn more about keeping your birds safe. But that really is the bottom line. Keep them safe. Now, here we are, 2 minutes to the end, and still no questions from our audience. So I hope that today's information has been helpful and answered all of the questions you had. There is a survey at the end of this webinar that will automatically pop up, and you may even receive an email with it again. We do intend to record and post this webinar so you can see the information at any time. Until then, please fill out the survey. We have one last webinar that we're looking forward to hosting in January. At that time, if you have questions, we will provide answers. We do aim to keep them to an hour or less. However, any of your questions that are urgent or important will be itemized to the top of the list for finding speakers and discussion points. We want to thank you for taking the step to prioritize your health, the health of your birds, and preventing illness wherever possible. My last thought will be make sure you get your flu shot. Check out what's going on in your area to be aware of illness and watch for those signs. Get rid of that standing water and restrict your access to your birds from any wild bird disease or any disease agents. We thank you again for joining, and we wish you all a wonderful day.